Private maternity wards have become a major casualty as the war between private health insurers and private hospitals rages on. At least 10 private hospitals across the country have closed their maternity service over the past 6 years, and that number is expected to rise as the New South Wales Central Coast prepares for its only private maternity ward to close in a matter of weeks. Dr Heather Waterfall is a specialist obstetrician gynaecologist and a member of the Royal Australian and New Zealand College of Obstetricians and Gynaecologists Private Practice Committee. Dr Waterfall, welcome to Radio National Breakfast.
Good morning. Thanks so much for having me.
Why are these private maternity wards closing? What is going on?
At the moment, the private maternity wards are mostly closing because of a shortfall in funding. Mainly the funding is coming from private health insurance, and unfortunately, that funding is not keeping up with the rising costs of providing maternity care in Australia. The other issue that we're facing is that with the cost of living crisis, women are dropping that top level of private health cover, and you've got to be in that top gold tier in able to be able to access obstetrics from your private health insurance. And both of those things are seeing a drop-off in funding to private maternity wards. They have to maintain a critical number of births in order to remain profitable. And at the moment, the lack of funding that's provided just isn't keeping up with the cost of providing care.
And how widespread and significant are these private maternity ward closures?
They're happening in both regional and capital cities. In the regional areas, it's very much more pronounced because often there's only one private maternity option for women. In the case recently of Cairns and of Gosford, those private maternity units closing mean that the women in those regional areas just do not have another option. In Adelaide, where I live and work, we had 5 private maternity closures when I first started work as an obstetrician, and in the last 5 years, 2 of those units have closed. So we're down from 5 down to 3 units. It's also happening in Sydney and other capital cities.
And do those closures, in your view, do they lead to a further decline? Because if women look around in their local area and there's no private maternity available, they don't go for those high levels of private health insurance, and on it goes.
Absolutely, yeah. I think it's a lot of what we see in private maternity care is women want close to home, they want safe access, and if there's nothing that is available to them, we're limiting their choices, unfortunately. And when we see these private maternity units close, women are losing the option of choice in where they birth.
You're listening to Radio National Breakfast, and I'm speaking to obstetrician and gynaecologist Dr Heather Waterfall. What sort of pressure is this placing on the public system?
So our public system is a very safe place to birth. It's a very busy place to birth. I work in public as well, and our public unit not only births a huge number of women, but it also trains the next generation of midwives and obstetricians. By adding on the births that are coming through from the private sector, keeping in mind that probably about 20% of births were being conducted privately in the last few years, as more women are unfortunately being forced into the public model and their choice of private care is being removed from them, we are going to add more pressure and more births into the public system. What
action do you think we need to see from the state and federal governments and the private health industry as well?
I think that private maternity care is so important for women as a choice. We're not talking about taking away options in terms of what public care women can receive. That, of course, is very, very important. But some women want to choose private care, and they're willing to make the financial sacrifice to obtain private care. And private care is not for everyone, but women should be able to make that choice and have that option available to them. The option of having a private obstetrician and continuity of care is so important for them. We need significant input from state and territory governments and from federal government as well. We've talked previously at the College of OB-GYN that Medicare has significant gender bias associated with it, and we also believe that private health insurance and the way they pay also has significant gender bias. why is it that procedures that predominantly affect women receive so little reimbursement compared to procedures that primarily involve men is a big question, and that's a question for Medicare, but also a question for our private health insurers as well. It does seem questionable that someone who needs a knee replacement who has had gold private health insurance can go and have their knee replaced at their private hospital of choice, but a woman who's paid for gold private health insurance who wants to have a baby is suddenly having her options limited because private hospitals can't afford to provide maternity services, yet providing knee replacements is very well reimbursed by both the private health insurers and by Medicare. It doesn't seem fair for young women when they are having what is the most exciting but also the most scary time of their life, having a baby.
Dr Heather Waterfall, thank you very much for joining me this morning on Breakfast.
No worries, my pleasure.